Now we move on to session 2 for the afternoon, where we talk about the impact of social stigma related to COVID-19 on quality of um, professionals giving life, healthcare workers in Nepal. And this session will be taken by Rakesh Singh, public health professional. He is currently involved as a collaborator in Cosmos Research Project, generating outcomes in trials of interventions targeting multiple morbidity in low and middle income countries. Welcome, Dr. Rakesh.
Okay. Hello, everybody. Greetings from Nepal. And my name is Rakesh Singh, and I have worked as an academician, researcher, and public health professional in different universities in Nepal since several years. And I'm very much excited to speak on our research on social stigma related to COVID-19 on healthcare workers in Nepal and how it has impacted their professional quality of life. This study has been conducted by a group of researchers consisting of public health professionals, social anthropologists, psychiatric nurse, psychiatrists, professionals from community medicine and infectious disease. With 218 countries affected by coronavirus disease globally, Nepal is one of them. And COVID-19 has resulted burden on healthcare system in Nepal, as recently the healthcare system of Nepal has been differentiated into 3 tiers after the federalism has been imported in Nepal, right? So the system is quite fragile over here in Nepal, and which has impacted the healthcare system in Nepal due to this infectious disease. And social stigma has been linked with COVID-19 and affected different segments of the society, including healthcare workers. As from the literature, we have already known that stigma has been affecting different segments of the society in from other diseases like HIV/AIDS, leprosy, and which has already been burdening these infectious diseases more. So this stigma need to be uprooted, right? So social stigma, what is it then? It is a trait that deeply discredits and reduces a person to a tainted individual. And healthcare workers, apart from the social stigma, also battle from the fear of contracting this infection and working in stressful environments. And henceforth, our study aimed to assess social stigma of COVID-19 and how it has impacted on quality of professional life among healthcare workers in Nepal. So talking about the methodology that we adopted in our study adopted a cross-sectional quantitative design with an online survey conducted with the help of Google form, and the Google form consisted of 3 parts. First part was assessing background characteristics consisting of sex, type of job, province in which the healthcare workers were working, and whether they have served COVID-19 patients or not. Similarly, the second part assessed social stigma of COVID-19, which was assessed in terms of discrimination, fear, and acceptance of COVID-19 patients. And similarly, the third part was assessing the professional quality of life in terms of fatigue, burnout, and satisfaction at work, which was assessed by professional quality of life scale. The professional quality of life scale consists of 30 items with 3 sub-scales measuring satisfaction, burnout, and fatigue from professional life. And each of these 10 items were rated on a 5-point scale, with 1 being never to 5 being very often. And higher score on these sub-scales indicated higher satisfaction, burnout, and fatigue in professional life. This ProQoL scale uh, is a scale developed by STAM in 2005 and has been validated in different countries across the world, and has already been validated in Nepal as well. Similarly, this ProQoL, under this ProQoL, what is this satisfaction then? Satisfaction is about the pleasure to derive from being able to do work well, right? Similarly, burnout is something associated with the feelings of hopelessness and difficulties while dealing with the own work, and it reflects feeling that whatever efforts you make, it makes no difference or is associated with high workload or a non-supportive working environment. And similarly, fatigue is work related and secondary exposure to extremely stressful environment. In its symptoms include being afraid, having difficulty sleeping, or avoiding things that remind you of the event that has happened. Similarly, the scale which we used in our study for assessing the social stigma of COVID-19 is adopted from the study conducted in Italy by Ramaki et al. And the researchers from the Italian study adapted the scale to assess social stigma of COVID-19 from C et al. 2011. And this C et al. 2011 is based upon assessing the stigma related to HIV and AIDS. So this was already been adopted and which we have adapted in our study, right? And this scale comprises of a tool with 3 sub skills: measuring discrimination towards COVID-19 patients, acceptance of COVID-19 patients, and fear of COVID-19. And each of these sub skills contain 4 items, and each of these items were rated on a 4-point: strongly disagree 1 to strongly agree is equal to 4, right? And the scores represent professional attitude of healthcare workers towards COVID-19. Our survey was done via non-probability sampling technique among doctors, nurses, health assistants, and paramedics working in primary level or secondary level or tertiary level healthcare facilities in Nepal. And the professionals who were not involved in direct patient care were excluded from the survey. So a total of 421 healthcare workers across the country participated in the survey from, within a span of 4 weeks from 1st to 28th of August 2020. And the data.
Rakesh, I'm so sorry to interrupt you. Could you please share your slides with on Zoom over here? You're not sharing your screen.
Oh, I thought I have shared.
Yes.
Is it coming now?
Yes, we can see it now. Thank you.
Yeah, sorry for the, yeah. Okay, so the data that was extracted from the online survey, that is Google Form, was extracted in the SPSS version 20. And both descriptive statistics consisting of frequency percentage, mean, and standard deviation, and inferential statistics consisting of independent sample t-tests, ANOVA, and regression analysis were conducted. And the prevalence of stigmatizing attitude towards COVID-19 with regards to discrimination, acceptance, and fear were determined on the basis of proportion of responses as agree or disagree, strongly agree to the negative statements, and proportion of responses as disagree or strongly disagree to the positive statement of the scale. And ethical approval for carrying out this study was taken from Institutional Review Committee of Patan Academy of Health Sciences, Nepal. And this Patan Academy of Health Sciences, PAS, is a public tertiary academic institution dedicated for training prospective healthcare workers, especially for rural Nepal. And in 2010, it started with School of Medicine and it started training medical doctors. And later in 2016, it started School of Nursing and Midwifery. And in 2017, it started the program of Master of Public Health under the School of Public Health. So talking about the results from the survey and the healthcare workers demographic, the healthcare workers that participated in our survey were deployed from all 7 provinces of Nepal, with the highest, that is 39%, from Bagmati province. And this province is moreover with the maximum number of the healthcare facilities, and it consists of the capital city, that is Kathmandu, as well, and with the followed by Gandaki province with 17% of the responses, that is healthcare workers, and then Karnali province with 11%, and the list from the Sudur Paschim, that is the most deprived provinces of Nepal in terms of the healthcare facilities. Similarly, with sex-wise breakup, almost half were male and half were female healthcare workers that participated in our survey, and uh, among them, the health assistant were the maximum, that is 35.6%, and least were the other paramedics, which included ophthalmic assistant, other lab health workers. And similarly, with under the level of healthcare facilities under which the healthcare workers were working, the maximum were from the primary care, that is 47%. And talking about whether these healthcare workers is provided service to the COVID-19 patients or not, then 55% had already provided service to the COVID-19 patients. Then regarding stigmatizing attitude, it was found that 67.9% of the healthcare workers had stigmatizing attitude of discrimination towards COVID-19 patients, followed by 52% having negative attitudes towards acceptance of COVID-19 patients, and 27% had fear of COVID-19 percentage. And moreover, acceptance of COVID-19 patients was associated with whether they had provided service to the COVID-19 patients or not. And those who were providing service to the COVID-19 patients were having positive attitudes toward acceptance of COVID-19 patients, while there was not significant differences in discrimination and fear with regards to whether whether they had provided service to the COVID-19 patients or not. Similarly, it was found that healthcare workers were found to show discrimination towards COVID-19 patients across sex, with female having more professional attitude, and it may be that female are more bound in developing nations like Nepal with rearing and caring, and may have this kind of empathy towards the patients. And similarly, so discrimination was associated with the type of job, with doctors having slightly more positive professionalism, and with provinces as well, with the lowest low at Karnali and Sudur Paschim province, and with level of health facilities as well, with lower discrimination at the tertiary level. And the reason may be that basically there are more facilities at the tertiary level of healthcare facilities. And similarly, significant difference in fear related to COVID-19 was found across the type of job, with paramedics having lesser fear as they were not directly involved in patient care, and means yes, and working province with high in province number 1 and Pragmati province, and similarly history of providing service towards COVID-19, and more fear among those not served towards the COVID-19. And there was no significant difference in acceptance towards COVID-19 patients, satisfaction and burnout at work across working province, and history of serving COVID-19 infected patients. However, there was no statistically significant difference in fatigue at work across different background characteristics. And we assessed whether these sub-scales of social stigma of COVID-19 and sub-scales of professional quality of life were associated with one another and or not. Then what we found from the correlation coefficient, that the discrimination and acceptance were negatively correlated with burnout and fatigue. Similarly, acceptance was positively correlated with satisfaction, and fear of COVID-19 was negatively correlated with satisfaction and fatigue, and positively correlated with burnout. Meaning that with negatively correlated means higher positive professionalism in discrimination and acceptance were leading to lesser burnout and fatigue at work. Similarly, upon regression analysis, what we found that acceptance and fear of COVID-19 to be a strong predictor of all outcomes of the quality of professional life in terms of satisfaction, burnout, and fatigue, and accounted for 22% of variance in satisfaction, 21% of variance in burnout, and 19% of variance in fatigue of the healthcare workers at work. So coming to the key findings, what we found from our survey is around half of the healthcare workers had stigmatizing attitudes towards COVID-19. And 2/3 of these healthcare workers had negative attitude of discrimination towards COVID-19 patients, and a quarter of them had fear of COVID-19. With more positive professional attitudes towards discrimination and acceptance towards COVID-19 patients, there was lesser degree of burnout and fatigue at work for healthcare workers. With more fear of COVID-19, there was higher degree of burnout and lower satisfaction in professional life. And similarly, social stigma of COVID-19 was found to be a strong predictor of professional quality of life of healthcare workers. And with this, the underlying identified finding of this study as social stigma as a predictor of COVID-19 of quality of professional life, it is therefore utmost important to strengthen healthcare workers by emphasizing on measures to decrease stigma for effective management of COVID-19 outbreak in Nepal. As we all know that healthcare workers are the backbone of any healthcare system who are working for effective management of this uh, infectious disease outbreak. So as stigma, burnout, and fatigue all being the stressors for threat to the mental well-being of these healthcare workers, the timely and appropriate training, counseling, and stress management workshops need to be organized among these healthcare workers who are the backbone of the healthcare system in the situation of this stressful working environment at clinical settings during outbreaks in order to protect them from harmful effects. However, the study has generated novel results in our country. The study has some limitations, which include the study was cross-sectional and therefore the findings need to be interpreted with caution, as it could not establish the causation. And as the pandemic is uncertain with length of time, and the attitude of these healthcare workers may also change across the time with advancement in treatment, control, and management of COVID-19. So these things need to be taken into consideration while interpreting the results. And similarly, data extracted in this study is based on self-reported measures rather than direct observation of behaviors of healthcare workers. So what we could do in coming days is further studies should consider the qualitative approach to gather the detailed perspective of different level of healthcare workers regarding stigmatization of COVID-19 and understand their perception regarding the measures to enhance enabling environment for effective management of the outbreak. So with this, we would like to thank Institutional Review Committee of Partner Academy of Health Sciences for giving us permission to carry out this study. And we express our deep gratitude to all the healthcare workers who have participated in this research. And we would also like to thank Mrs. Ambika Thapa for her genuine support during the initial phase of the protocol development of this study. And with this, I would like to conclude my presentation, and any comments or feedback questions are highly encouraged. Thank you.
Thank you so much for the presentation. I would like to ask a few questions from the attendees. So the first question is, can you please share the reference tool that was used to prepare this tool? Thank you.
Okay. Means what tool was used, right?
Yes, yes.
Okay. For basically, as I have already said, there were three parts of the tool, right? So the first part was background characteristics, which was generated as per the need. The second part was assessing social stigma of COVID-19, right? So it was consisting of 12 items, right? 12 items with each with 4 items. Okay, so 4 items assessing discrimination, acceptance, and fear of COVID-19. And these each of these 4 items from this for these sub skills were were adopted from the study conducted means C et al, which was based for is assessing stigma of HIV, right? So it has been already adapted by Italian study, and which was directly adopted in our study. Okay, so
Thank you.
okay,
So,
and for professional quality of life, it is a standard tool, ProQL, and our study used version 5, which is already been validated in Nepalese context by Adhikari 2020, and it consists of 30 items, and each with 10 items for assessing acceptance, similarly satisfaction. Okay, and it consists of rating scale, and that's it. And I can provide the reference in the chat box as well.
Okay.
For showing.
Thank you so much. We have another question, which is, have newer strategies like telemedicine, telehealth been explored and deployed by hospitals also?
uh, for this COVID-19.
Yes.
Okay. For COVID-19, not in large scale. For example, institutions like Patton Academy of Health Sciences, right? This Patton Academy of Health Sciences has been collaborating with other healthcare facilities in rural Nepal, like other districts like in Makwanpur, similarly Gorkha, similarly Rupandehi, right? So for these, we have been using telemedicine approach as well to train healthcare workers at grassroots level. But if you say it at large scale, then it has not been it at large scale.
Okay. Thank you so much, Rakesh Singh, for this insightful presentation. And we all know this is a very important issue for healthcare workers in this region. Thank you for joining us today.
Thank you.